Welcome to today's episode, brought to you by the Women in Medicine Summit, a transformational CME conference happening September 13th to 14th at the Drake Hotel in Chicago. Engage in leadership programming, learn negotiation skills, receive on-site coaching and mentoring, and see who will win this year's I Stand With Her awards. This year, we're excited to offer unique programming that includes a special session on how using improv comedy can bring fun back into medicine. We also have financial sessions tailored to help you navigate the complexities of personal and professional finances. Discover ways to advance into leadership roles, combat burnout, and either reignite your love for your current role or find joy in a new career path. Don't forget our Friday evening gala, a highlight this year you definitely won't want to miss. Register now at womeninmedicinesummit.org and be part of the movement that is shaping the future of healthcare. Join us to network, learn, and celebrate the power of women in medicine.
Welcome to the Revitalizing Doctor podcast. We interview trailblazers in medicine that embody the Revitalize Women vision to empower women to innovate and influence medicine, to value authenticity, respect, and work-life harmony. We recognize the challenges in medicine, and we're committed to providing coaching-informed strategies to help you go from surviving to thriving. I'm thrilled today to have Dr. Danielle Douglas with me. She is a friend, a colleague, and also my own doctor. We'll get into that in a little bit. I want to start off the way we usually do on the podcast. Danielle, why did you become a doctor?
Well, thank you for having me. I'm super honored to be here and excited to talk to you. Gosh, why did I become a doctor? I think there are a couple things. One is I have a twin sister who is severely mentally and physically disabled. And so I was always around medicine growing up. I always was interested in optimization of health. And as I kind of changed from ER to functional medicine, I think I realized that she had a large impact on my wanting to fix things. And I could never fix her, but I think learning about how to fix people, she really had a driving force on why I became a physician.
Wow. I did not know that story. Mm-hmm. That's so interesting. I think what you just said, that word fixer, that's been something I've been thinking a lot about. I just finished up a 6-month program with Cherie Johnson, who's a psychologist, and she runs something called Recalibrate. And part of it is playing with your identity as a doctor. And I think we're both emergency medicine physicians, and fixer was definitely the way I identified. And the last few months, I've been trying to say, well, a lot of what I do, I can't actually fix, but can I always heal? Mm-hmm. How does that land with you?
Yeah. And it is true. Like, you can give people the tools, but it has to be a effort between both of you together. So I think what we do sometimes in allopathic medicine is we give people a drug to fix themselves, but we don't engage them as much into their own healing. And what I focus on more now in my practice is we work together, and I try and figure out where the patient is at more so and how they can contribute to their health. Because the more a patient is part of that process, the more empowered they feel. And I feel the outcomes are better.
In some ways, I think the listeners hearing that, well, would you say you are or you were an emergency physician?
I think I'll always be an emergency medicine physician, right? That's such a huge part of my life. I mean, I started when I was 14, working for a volunteer emergency medicine service in the town of Darien, Connecticut, and then was driving ambulances at 16, delivered babies, and so it has encompassed so much of my life, that emergency EMS field, but I don't define myself by my profession. Like, it is what I do. I'm very used to doing it, but I do say that I am still an emergency medicine physician, but I'm also practicing functional medicine.
And from an outsider's perspective, it seems like there aren't two specialties that could be farther apart. Emergency medicine and functional medicine. And we're going to get into it a little bit, but some of the listeners will remember an episode I did with a physician on lifestyle medicine. She's also emergency. medicine. That was Raquel's episode, so people should go back and listen to that one. How did you find functional medicine? Because it is different than emergency medicine.
Right. I was always interested in non-typical allopathic medicine, right? And I think my mother always thought out that, and she always was open to alternative treatment. So whether that be chiropractic or yoga or meditation. And so it was always brought to me as just equal, but a different way of looking at health. And so when I read about Tibetan medicine and in medical school, and I thought that was really interesting, like how does this person feel my pulse, look at my tongue, and determine if I'm healthy or not? I thought that's crazy. And I went to this Tibetan medicine physician who happened to be the physician for the Dalai Lama, Dr. Lobsang Danup, and he works in Encinitas. And I went there and he told me I should be a functional medicine physician. And so I went home that night and I looked up functional medicine, and there was a picture of mitochondria and all those pathways with the enzymes. And I thought, oh my God, this is so boring. I would never, ever do this. And so I was an ER doctor at the time. And about 5 years later, my best friend, who is also an ER doctor, she said, you need to listen to this podcast by Dr. Mark Hyman, who is one of the founding fathers of functional medicine. And I started to listen to it and I was like, oh my gosh, this is exactly how medicine should be practiced. The optimization of health, the creation of health, as opposed to the treatment of disease. And I couldn't get enough of it. It's literally kind of like why I went into medicine. Like, how can I make myself as strong and as healthy as possible? And when you go into the ER, 15% of the time, as you know, it's like super intense, like problem, high cortisol state, fix the problem. Yes, like save the life or, improve the person. It's immediate gratification. But, 85% of the time, it's chronic disease. And I feel we are failing on the front lines of really dealing with that. And why is that occurring? And looking at people individually. So it's not so different. 85% of the time, we're doing functional medicine, or we should be doing functional medicine in the ER to really optimize these people's health, because it's not just a wound and a Band-Aid. Sometimes it is a wound and a Band-Aid, and you really need to do that. But a lot of the times it's not. So the two are intimately connected. It's health, right? It's medicine.
Some of our listeners are still probably wondering, but what is functional medicine? Can you break it down for them?
Yeah. So functional medicine is systems-based biology medicine. So instead of being like, you have depression, here's your SSRI, or here's your lithium, it looks at like, why is the depression occurring? And it looks at, it's multifactorial, right? It looks at many spokes of the wheel that can cause depression. And it's treating all of those things at once instead of just looking at one neurotransmitter and addressing that. So whether that be nutritional deficiencies, we know the neurotransmitter in the brain that deals with serotonin requires zinc and selenium. If you're deficient in those, you are not going to be as optimized dealing with the depression as if you had those nutrients. And we see that with people, even when you do put them on the SSRI will work more effectively if you have the right amino acids in your system to support serotonin production or dopamine, norepinephrine production. So nutritional deficiencies is one factor. What we say in functional medicine typically is almost all major medical issues begins with some sort of spiritual or emotional stressor. And if we do not deal with the spiritual emotional stressor, we're not going to as effectively treat the problem that's on hand. So nutritional, emotional, physical, right? Dealing with what are their physical capabilities, exercise. So it's a multi-pronged approach to dealing with actual disease as opposed to allopathic medicine, which is kind of like symptom treatment. And then also it does look at systems, right? So inflammation. We have inflammation within the body, and depending on your genes, that may manifest as cancer. It may manifest as diabetes. It may manifest as cardiovascular disease. But what we do is we treat the inflammation through diet and lifestyle and perhaps supplements. We decrease the inflammation, and the manifestation of that inflammation decreases the symptoms of diabetes, cardiovascular disease, cancer. So it's a different way of looking at medicine.
And I'm guessing before you picked functional medicine and signed up for the program to get your fellowship training, you looked at other things. So some of our listeners are probably thinking about, should they get the lifestyle medicine board certification? How is this different than integrative medicine? Can you get into that a little bit?
Yeah, so integrative medicine is the integration of different modalities of care to create health, right? So I, in my practice integrative medicine, right? I'm not only practicing functional medicine, I'm practicing allopathic medicine. I'm integrating yoga, acupuncture, chiropractic, physical therapy, meditation, all those things. That's an integrated practice. So my practice is integrative, but functional medicine, why I decided to become a functional medicine provider instead of getting, say, an integrative physician fellowship was because I really liked the lab testing. And that was more akin to me as an allopathic doctor, right? It was like labs don't guess, right? Tests don't guess kind of thing. And so I had numbers to show patients, which, it's always like treat the patient, not the number. However, sometimes it really helps to have those numbers to be like, look, this is your cortisol level throughout the day. This is what you need to do. Because people are like, I'm not stressed, or having those numbers are helpful. And then you're using these herbs as pharmacological agents, right? You're using them at certain doses to create a physiological effect in the body. So I'm using vitamin C at high doses as an antioxidant. If you're not doing that correctly, right? Because you can just go into any store right now, buy a supplement. And if you're not taking it at the dose that it's meant to be taken at, it's essentially taking like half a dose of penicillin. So knowing how to dose these things, when to use them, and based on laboratory markers, which you can actually monitor over time, to me was really appealing. And it was more akin to allopathic medicine as opposed to naturopathic medicine.
Stay tuned. We'll be right back. Are you a physician mom with school-aged children feeling utterly exhausted? My friend Dr. Sheeta Shaffi invites you to take a little time this summer to join her in a small, intimate group for meaningful conversations. Dr. Shaffi is an emergency physician, coach, and mom to 8-year-old twins. She understands firsthand what you're going through. This isn't a pizza party or a yoga class. You'll meet for 2 one-hour sessions twice a month starting in July to help you move out of exhaustion, let go of mom guilt, and live a life you're not only proud of, but can truly enjoy. Connect with her on LinkedIn or Instagram at Sheeta Shaffi to learn more. Sheeta is spelled Shideh, and Shaffi is spelled Shafie. You can also check the show notes for a link so you can connect with her there as well. I've gone through the functional medicine workup and seen my labs, obviously. What's frustrating, though, is, at least in my case, my HSA didn't cover it. My insurance company didn't cover it. I know you have some clients that it has. Why is medicine so slow to respond to, I know you personally, you're an amazing emergency physician. You are incredibly data-driven. So I know you wouldn't be practicing anything that isn't scientific, but why aren't we seeing this more uptake, or are we?
I think you are seeing it. It's definitely uptake. The Mayo Clinic, major health system within this country, has a functional medicine department. Harvard is having functional medicine department. It's just the barge of medicine is difficult to move, as we all know, right? Practicing as an ER doctor. And it will get there. It's just unfortunate for those of us who need it now and don't have the financial means to support it. No, in my practice, I do offer discounts and I give payment plans to patients, but there aren't a lot of people that can do that or are willing to do that, which is unfortunate. And I think the NIH needs to do more studies and give grants to hospital systems to develop functional medicine programs. This will help the outcome in this country, which is a $1 trillion business, right? Healthcare. So we need to cut the costs somehow, because we're just kind of bleeding as we try and practice the way we've been doing.
And I say, on one hand, like, it's expensive. But on the other side, I think about my parents and my dad's, I don't know what part of the donut of the Medicare thing, but one of his medications was, his copay was like $400 a month or something crazy.
Mm-hmm.
And this is somebody with, quote, good insurance.
Mm-hmm.
And, I think about the health struggles that he's had. And so, like, if you took that $400 and you put it together into, 6 months,
Mm-hmm.
maybe he could have had a functional medicine workup and got at the
For
root
sure.
cause instead of the 6 medications that are covering everything up.
Right. And then decrease the utilization of medicine. And the idea is not to be on supplements forever, right? They're supplemental to lifestyle changes. So yes, are there some supplements we all probably need to be taking because our food is so depleted of nutrients? Mm-hmm. Yes, there are some baseline supplements, but for the most part, a lot of this you can change with lifestyle.
I'm guessing there's a few listeners that are really curious about more of the logistics of your training. Where did you go? What was it like? Were you still practicing emergency medicine while you were going through that training?
Yes, I did, while raising 3 kids during the middle of a COVID pandemic, which probably isn't great for my health. But I did. I did a 2-year kind of fellowship with the Institute of Functional Medicine, where it's different modules, probably 8 modules you have to go through. And then at the end, you have to take a board certification and then also a case presentation to get certified by the Institute of Functional Medicine, which it kind of gives legitimacy to the practice, similar to the American, Board of Emergency Medicine. So that's kind of like the medical school. And then I went and trained later at the Dan Kalish Institute, which is like the residency after the medical school. It's kind of teach you how to implement all these things that you learned, along with the supplements, the dosing, things like that. That really helped. And that was 2 years. And then I still take classes just to keep learning. And then I also trained with Mark Hyman. He has a program for physicians and doing a lot of his classes and ongoing podcasts as we do in ER. Every time I went to a shift in the ER, I was listening to EM Rap for 15 years, 20 years actually through residency. So 20 years, I was driving to my shift, listening to EM Rap to stay up to date. And so medicine's changing so rapidly. And that's what makes it so interesting, but also so difficult to be a really good provider because things change. And then as you see in ER, they go back to where they were 15 years ago, which is another reason I was like, okay, you know what? I've done this. Now we're going back to treating AFib the way I was doing in residency. Let me learn something different. I needed something new. And I had already learned about that stuff. And I really wanted to learn something new. And this kind of filled that niche.
A lot of our listeners are emergency medicine still, or they're doing something else. I mean, just allopathic medicine in general, I think is really stressful. Do you think you can be well and be a practicing full-time emergency physician?
Yes. Yes, I do. And it's how you deal with the stress, because life in itself is stressful, right? Like, how do you cope with that? And you have to make sure you take time to cope with that, whether it be you're an air traffic controller or a mother of 3 young children. It's like we're always going to have stress, but making sure you're doing 90% of the time things that are good for you, right? So that means eating a diet that's rich in nutrients that support the body, making sure you're getting adequate sleep, making sure you're doing things like meditation, whether that be prayer, whether that be just deep breathing, whether that be just walking on the beach, where you're focused just on what you're focused on. It doesn't need to be oming in a corner. For some of us, that's really beneficial. For others, that just doesn't work. But going for a gentle run on the beach, as opposed to the triathlon, HIIT, high intensity interval training runs, where you're just supporting the system to do what it needs to do. And then you can be there for your patients. So yeah, it's definitely possible.
That's awesome. Yeah, I think that's, when I met you, I was still, coming out of COVID, and that has certainly been front of mind. I think the answer I'm at right now, which, I think it's always changing, is yes, I think you can be well. It does take a lot of intentionality.
Mm-hmm.
And
for sure,
factoring in that recovery cycle. And for me, I've switched from Whoop to Aura because I lost my Whoop device, but they're very similar. I actually like that recovery score. And I don't know if you use either one of those devices or are familiar with them.
Mm-hmm. I don't use it personally.
Okay.
But I am familiar. And so it is good to have those numbers and look at what you do in your life. Like when you have that alcohol drink before you go to sleep at night, when you're looking at Netflix before you go to sleep at night, and then looking at your REM, looking at your deep sleep, like what does it do? And so it doesn't mean never watch Netflix before you go to sleep at night, but those nights that you take the time to do some deep breathing for maybe, 5 minutes before you go to sleep, what is the quality of your sleep like? How rested do you feel in the morning? Knowing that, it's a really good thing. And then just not becoming obsessive about it too, because we tend to become obsessive about numbers. And then that is detrimental to the overall.
Right. I totally agree with you. And I will take device breaks. I mean, there's just sometimes you go through a phase where your recovery scores aren't good for a number of reasons. Maybe you're recovering from a viral illness, or you're on a string of nights, or there's something else going on. And when you keep seeing that like red, you're in the red.
Yeah.
It honestly, for me, just starts to make me feel worse. And I'm like, okay, we're going to put this away for a week or two and then come back to it.
Sure.
A big part of functional medicine is nutrition. There's countless podcasts, books on nutrition. For our listeners, if you had to give one tip or a place to start, what would you recommend?
So eating the rainbow every day. So trying to vary your diet and eat a colorful diet, because the more color and the more variation you can get in your diet, the more robust your microbiome is, right? The gut bacteria. And we know that the more robust your microbiome is, the more resilient you are to different stressors, whether that be infection or stress in itself, of, high cortisol state because of your lifestyle or your job. So yeah, eating the rainbow and varying your diet. So when you go to the grocery store, try and buy something new every time, like you're not used to eating.
If somebody wants to find a reputable functional medicine doctor, what would your advice be?
I would say go to the IFM.org, Institute of Functional Medicine.org, and you can find a practitioner in your area. And there's a list of certified practitioners. The practitioners are variable. Some are MDs, some are naturopathic doctors, some are chiropractors, some are, so you want to look and see, what kind of practitioner you want to go to. I have a preference for MDs just because of the background, right? Like I want my providers to be kind of working with each other, not against each other. So being okay with allopathic medicine, because a lot of patients are, but they want to integrate this other thing. They don't want to just throw the baby out with the bathwater. They want to actually have both. And so having a physician that's knowledgeable for both and how those herbs will interact with the drugs that they're on and how they can maybe be used in lieu of the drugs they're on, I think is really important.
Yeah, I would say as a patient, as a doctor, I think both, I would feel more comfortable with somebody that's had the allopathic training. And I remember when we went through my labs, there was one lab that you're like, not sure about this. You actually need to talk to your primary care doctor about that one.
Yeah.
So I think that's where my bias would be that, I think the human body is very complicated. And I think allopathic medicine is missing some of the answers, but I do worry about somebody that's only seeing it through that lens and hasn't seen. It seems it would be weird to me if you've never prescribed some of the blood pressure medicines that we use in allopathic medicine, and then trying to talk a patient through how the herbs or diet changes or whatever it may be may interact with those.
Right.
Can you give our listeners a glimpse into what a typical functional medicine workup would look like, just so they have some idea of what they're maybe walking into, knowing that every practitioner may have some differences in how they approach that?
Yeah. So in my practice, I do a pretty extensive initial intake where I determine kind of their medical history, their social history, all these factors that contribute to health, their diet history, their exercise history, their dental history, their birth history, a very extensive workup, right? And then I utilize that to determine what initial tests I think are appropriate. And I also try and get the biggest bang for the buck, right? So there are thousands of dollars worth of tests out there that I can order right off the bat. But I know by manipulating certain factors, like working on the HPA axis, the hypothalamus, pituitary adrenal axis, we are going to shift the testosterone, estrogen, the sexual hormone levels, and also cardiovascular levels, right? Inflammation So getting all those off the bat are interesting for the patient, maybe if they want a comparison, but not necessarily necessary right off the bat. And so I try and limit my initial workup to being 3 to 4 labs and then integrate things over 6 months where I'm working on diet, nutrition, lifestyle, supplements. And then I retest and may add in 1 or 2 more, depending on how the patient's doing and where they want to go from. So typically patients will work with me for 6 months where we integrate these changes and I check in with them pretty regularly, once a month, and I'm seeing how they're doing and if something's working for them. Because if I tell them to go, let's swim La Jolla Cove and they don't swim, that's not going to work, right? So I have to revamp and reframe and make sure the supplements are okay. And if it's too expensive, I have to revamp them. So it's really a close practice that works closely directly with the patient. Now, there may be other practices that work differently, but I find that the outcome is better in my practice for that type of closeness with the patient. And that's the way I like to practice.
Do you work with a health coach or anyone else to help with these check-ins?
So I always check in once a month, but the patients have, by signing up with me, 3 visits with a health coach, which helps integrate these recommendations that I made. And whether that be helping with exercise or helping with meditation or helping revamp, okay, this job isn't something that you want to be doing. How are we going to change that over? They help extensively with that process. And then I will also send out patients, say they have addiction, with addictive, either disordered eating or alcohol or drug abuse history, and they need addiction counseling. I have someone to work with them on that. Or trauma. I have a psychiatrist and psychologist that work with past trauma, EMDR, because I'm not everything. And you have to know what you're good at and then refer out, because I'm not going to be an acupuncturist, or my physical therapist may do wonders for a patient. So knowing when to refer and what modalities to refer to is part of the process as well.
Kind of sounds like you're using your ER skills in a new way, right?
Yeah.
Yeah. I think that's really refreshing for our listeners. I do want to pick your brain. I think a lot of people listening work for a group. They work for a hospital. And the idea of starting their own business is very daunting. Do you have any advice for them?
Know what you can manage. I have 3 children. Having a huge practice with multiple providers underneath me and managing that was not something I wanted to do. I wanted to be able to keep it small so I could also be part of my children's lives. That was not my goal. So knowing what your goal is in practice before you start is super important. And also using other practices as benchmarks, getting the advice of people who have done it before you, because it'll save you a lot of money and it'll save you a lot of time, which is basically the most valuable resource you have.
So what I heard was be clear on your values.
Correct.
Your boundaries.
Correct.
And use your network.
Correct.
And that's what we talk about at Revitalize all the time. So that's great. I mean, you're a living representation of that process, that when you get clear on those things, sky's the limit.
Yeah.
If there's some of our listeners that want to connect with you, maybe they're in San Diego area, Southern California. Well, first of all, let's back up. Your clinical practice, if somebody wanted to see you as a patient, do you only see patients in California?
So as an MD, you are not allowed to practice outside of the state without a license in other states. Now, patients from other states can come here and see me for their first visit and then go back to where they live, and that's fine. And I can speak with them over telemedicine. I do have patients who live in Maryland, Connecticut, other states, and they do wonderfully. Patients can look me up on my website, lajollafunctionalmedicineclinic.com. or drdaniellemd.com. And they can learn more about my practice there. They can learn more about functional medicine there. And they can set up a telemedicine appointment or in-person appointment to meet with me.
Amazing. Well, it's been such a pleasure speaking with you today. And I hope that we inspire our doctors to go to the doctor, maybe see a functional medicine physician themselves. And then if they're interested, start exploring, start finding out, what would resonate with them.
And it's so important too, I think, for physicians to take care of themselves, because how can you teach someone how to do something that you're not doing? And you're so much more successful if you're actually a role model for your patients. And optimizing your health through functional medicine, I think, is a great way to do that.
No better way to end the episode. Well, I hope to have you on the podcast again soon. Thanks for listening to The Revitalizing Doctor, a project of Revitalize Women Physician Circle. Our mission is to connect women physicians and allies through innovative, value-based coaching methods that align trust, support, accountability, and skill development to ignite the courage and clarity necessary to take bold actions, create change, and thrive. If you're interested in working with us, check out our website at peoplealwayshcc.com/revitalize or email us at revitalizemmm.info@gmail.com. This podcast represents the views of our host and guest. It does not reflect the views of any institution we work for or with.
Hi, it's Dr. Risa E. Lewis, dropping in to tell you about a book that Dr. Adara Landry and I wrote. It's called Microskills, Small Actions, Big Impact. It's a business self-help book coming in 2024 by HarperCollins. Pre-order now. Microskills, Small Actions, Big Impact, wherever you buy your books.